your question. So if you have read and understood, have you read all?
Yes, ma'am. I read.
All right. Okay. If you have read and understood, considering its surgical pathology station, kindly tell me what is the pathogenesis that the patient is going through in this condition?
Here, as the patient had the polytrauma,
Yes.
the patient is a known case of hepatitis C. I suspect that the patient had liver dysfunction already.
Yes.
And on top of that, as the patient has multiple fractures and splenic injury,
Yes.
there is a patient might be having a hypotensive shock.
All right.
And patient might also be suffering from disseminated intravascular coagulation.
All right. So what would be your provisional diagnosis for this particular patient?
My provisional diagnosis would be a disseminated intravascular coagulation, ma'am, first diagnosis.
All right.
And also hypovolemic or septic shock would be the other possibilities.
Followed by, yes. Okay. So how would you define disseminated intravascular coagulation? What is it? What
DIC,
happens
ma'am.
Yes. What happens in this situation? How would you define
it is a type of consumptive coagulopathy where there is simultaneous activation of the coagulative system leading to consumption of coagulation factors and a massive widespread hemorrhage. And also there is a simultaneous fibrinolytic system activation, which increases the chances of bleeding, and it decreases fibrinogen, and there is increase of fibrin degradation products.
Considering the fact that patient is a known case of hepatitis and now patient is undergoing DIC, how or what your plan of management be?
As the patient is a known case of hepatitis, there might be a deficiency of clotting factors.
Very good. Yes.
Vitamin K dependent clotting factors. So I would like to replace the clotting factors by giving either fresh frozen plasma or cryoprecipitate.
Yes.
Also, the patient might need a platelet transfusion to control the bleeding.
All right.
And
yes.
Transfusion of PRBCs if the hemoglobin is low.
All right. Considering the fact that patient is bleeding and patient has multiple fractures as well, definitely she needs surgery. How would you plan to go? Would you manage the patient first, stabilize the patient first, or would you go for the surgery right away?
I'm here as the patient has a splenic injury. It is an emergency case. First, I would like to resuscitate the patient by by controlling the airway, breathing, and giving circulation. I would take blood samples for grouping and saving and cross matching, and then after the patient is stabilized, we shift the patient to the operation theater for the splenic evaluation of the splenic injury, and if needed, splenectomy.
Yes, right, good. What blood products can you give to the patient to stop or combat the ongoing bleeding?
To prevent the bleeding, we can give platelets, and along with cryoprecipitate fresh frozen plasma. Also, we can give tranexamic acid to decrease the bleeding.
All right. What is the function of platelets in the body in this particular situation?
Platelets, because of their adhesive and cohesive function, they are responsible for formation of the platelet plug, in the
Yes.
process of hemostasis, and
Yes.
also they activate the coagulation pathway,
Yes.
and which leads to the formation of fibrin clot.
How these platelets are formed from the bone marrow?
The platelets are formed from the precursor megakaryocyte cells by fragmentation in the bone marrow.
Yes.
There
Give
is ma'am,
under, if you were telling me under which hormone?
under thrombopoietin.
Thrombopoietin, yes. Okay, good. What other conditions, what other blood products did you say you can give? with this
Fresh
patient?
frozen plasma,
Yes, and
cryoprecipitate,
yes.
and packed red blood cells.
Why you will not give packed red blood cells?
Why we will not give pack?
Or once giving packed red blood cells, what precautions would you keep in your mind? You will give packed red blood cells. I wanted you to tell me that you will give. All right. In the
Yes, ma'am. I got confused there.
yes, I wanted to make sure that you know what you're telling me, because if you're giving packed red blood cells, RBCs, how much percentage of white blood cells does it contain?
It contains less than 5 into 10 power 6 cells, ma'am, per liter, which
Yes.
is leuko-reduced packed red blood cells.
Okay. You said you'll do the ABO, you'll do the cross matching. Once doing the cross matching, what is more important to consider?
ABO grouping
And
is important, and the presence of RS
RH.
typing.
Yes.
RS typing.
Okay. Right. Can you tell me? Right. Okay. I want to know if you can tell me what activates intrinsic and or extrinsic pathway.
Intrinsic pathway is activated by damage to the vascular endothelium, whereas
Yes.
extrinsic pathway is activated by the tissue thromboplastin factor.
Once you're doing prothrombin test, so that acts on which pathway?
Prothrombin test assesses the extrinsic pathway and the common pathway.
Common pathway. Okay, good. If you introduce blood or blood product to this particular patient, what type of reactions are likely to happen?
The patient can have allergic,
Hypersensitivity.
hemolytic,
Yeah.
ma'am,
Yes.
allergic hemolytic reactions, and patient can have electrolyte disturbances.
This
If
will lead to, yes.
and usually if the blood is clean, then there is less chances of infection. Otherwise, infection chances, then hyperkalemia
Yes.
and hypocalcemia,
Even
and
septicemia.
transfusion associated lung injury and septicemia. These complications can occur.
Okay. In post-operative patient, what is the most likely infection which occurs? Which organism is most commonly seen?
Staphylococcus aureus, ma'am.
Okay, this particular patient after splenectomy, just suppose she undergoes splenectomy, what advice would you give to the patient afterwards?
Following splenectomy, the patient has an increased risk of infection, and so against capsulated with capsulated organisms, so patient needs to undergo vaccination
Yes.
against Haemophilus neisseria and pneumococcus, ma'am. And
Yes.
also, patient might need prophylactic antibiotics to prevent infection.
For how long and which antibiotic?
Broad spectrum antibiotic such as coamoxiclav.
According to the NHS guidelines or Trust guidelines, because once you'll be working there, so you have to follow the Trust guidelines or their protocol. So very good.
Okay.
Good. Thank you. Yeah.
Okay.
Thanks.